Hello, my name is Cassey Hall, and this is Amber, my patient for the day. This is my head-to-toe assessment of the neck, thyroid, lymph nodes, thoracic expansion, diaphragmatic excursion, and the anterior, posterior, and lateral percussion of the chest. Prior to entering the room, I washed my hands. My patient emptied her bladder and placed on a gown, but for today she's going to wear a t-shirt. And I took the vital signs, and they are within normal limits, and we did a height and weight. I'm going to begin with the neck. It is supple. The muscles are symmetrical on both sides. There is the color is pink, and her trachea is visually midline, no obvious deviation, no thyroid growth or goiters noted. And no apparent JVD. We're going to begin with her range of motion. If you could please put to one shoulder and then the next, and then extend and flex. And we're going to do the same with my resistance of my hand. Bless you. On the other side. Now extend and flex. Good. Now shrug your shoulders out against my hands. Okay. And now I'll move to her carotid pulses, feeling them one at a time for strength and regularity. Okay. I'd say it's about 2+ equal bilateral. And now I'm going to move to her thyroid. Her trachea is positioned at kind of the base of the neck, and it is symmetrical. I don't feel any tracheal tugging. If you please swallow. And the trachea feels smooth, and no apparent deviations or growths. Now I will use my thumb and move her thyroid over, and I will feel no growths, no abnormalities felt, and I'll use my other thumb and push it to the other side. No growths or abnormalities felt there. Okay, now I will listen to her carotids and her thyroid for any bruise, and I will use the bell of my stethoscope. And whenever I do this, can you please take a deep breath and hold it so I don't hear your breath sounds? No bruise heard over the carotids or the thyroid. Now I am going to move to her lymph nodes, and we will begin with the preauricular, the postauricular, the occipital, the tonsillar, submandible, submental, superior cervical chain, posterior cervical chain, the deep cervical, and supraclavicular. Okay, and no nods, no swelling, no obvious pain from the patient felt. Now if you could please turn around, I'm going to look at your back. And I want you to kind of bend forward and cross your arms. Thank you. I'm going to raise your shirt up. My hands are cold, I'm sorry. Okay, I'm going to place my hands at about the 10th rib, and my thumbs will be at the spinal process, and I'll have her take a deep breath, and I'll watch my thumbs expand. I'll take a deep breath. All right. And my thumbs expand equally, no deviation to one side, no lack of expansion on one side or either. Now I'm going to perform the diaphragmatic excursion, and what I'll do is have her take a deep breath, and I will percuss up her back while she holds that breath and listen for dullness going to resonance. If you could take a deep breath. Okay. Okay, now breathe. All right, now take a deep breath and exhale all that you can, and then hold it. Now we'll percuss up from that area. Listen again from dullness to resonance. Normal is about 3 to 6 centimeters, and I would say hers is about 4 centimeters. Now I'm going to percuss your posterior, then I'll move to your lateral, and then I'll go anterior, and we'll percuss the same way, the same pattern that you'll auscultate in. Okay. You want to go into the intercostals. Okay, resonance was heard posterior. Now I'm going to have you move your arms up and kind of cross them over your head and sit up straight. Okay. I'm going to percuss laterally. Resonance there, no hyperresonance or dullness. Now I'm going to have you switch over in the seat again, kind of turn towards me, face me. Okay, now I'm going to have you do the same thing. All right, and resonance was heard through there. Thank you, and that concludes my video.